first and foremost, I just want to say that I'm really delighted to be here. In fact, I think Dhiraj is absolutely right that, every time I talk about data science and data analytics, the first name that comes to my mind is always Mu Sigma. This was a huge opportunity for a country like India, and I think you were the first ones who actually saw this opportunity way ahead of others, and I always feel that that's so important. Because whilst we are making things happen, there are many companies who are waiting and watching and saying, let's see, is it worth getting involved? And by the time they make up their mind, they wonder what happened. So I think this is a very exciting time that we are living in. Of course, now everything's happening in such a rush that you don't have time. But when I started Biocon in 1978, I can tell you that it was a very, very challenging time, because I was trying to build a very sophisticated biotech company at a time when we didn't have reliable power supply. And biotech can't be done without reliable power supply. There were no computers, there were no phones. You suddenly find people who start getting very excited with what you're doing. And my initial team of people were those people with whom I could get a mind share. So they were very excited with what I was trying to do. I was trying to develop these biotech products, enzyme technologies, based on yeast and fungi and bacteria, and trying to make recombinant DNA technology. For any company such as Mu Sigma, such as my own company, it is an endurance test. How do you endure? I think that is very important. Fierce purpose. I wanted to do something, and I wanted to do it my way. So I guess that sort of drives you to do certain things. So I always tell people that whatever you do, you must be totally absorbed in what you're doing. And if you're really driven by what you're doing and you think you're on a mission, I think you find a lot of energy to do all this. But I think it's a lot about the level of engagement in your job responsibility that makes you gritty. Or stick with that job. I've always thrown people into the deep end saying, solve this problem, then you'll feel very inspired. So, sort of celebrate when they solve problems.
Celebrate solving problems. Yeah.
I find that in our country, it's about individuals who are involved with government issues or aspects of healthcare. For instance, I find that in many states, there are individuals who drive these kind of things.
So it's also about identifying these
catalysts. So you must identify these catalysts and work with them, and then you can do a lot. Many industry segments which have not really bothered about leveraging data science and information technology in the true sense are suddenly finding that, my God, we've lost a huge opportunity, and they're trying to play a catch-up game. The healthcare sector is one such sector. But sectors also have been working in disconnected silos. Universal healthcare is very easy to conceptualize, but very difficult to deliver on, because it's a very expensive model, because we have not interconnected it. We have made this whole regulatory framework for many of our sectors so complex, because you can't centralize anything, because it's a state subject. Now it's up to the state to roll out a healthcare scheme. It is not at the center to do it. So it's become so complex that again it's about connecting the dots. And if you could actually develop a healthcare system that connects all the dots, you would have a very efficient healthcare system.
We have 1.4 billion people, 1.3 billion people in India, and then China also. And there's the density of human beings between these two countries is probably, the highest, and therefore healthcare is going to become a big issue here.
First, you have to have your broad healthcare model, and I've always believed that the healthcare model actually starts with primary healthcare. If you think of primary healthcare, it has to be a diagnostic and preventive care model. It all starts with creating and generating that primary data. That primary data is your electronic medical record. So it's like your Aadhaar card, no, right? How do you create your medical Aadhaar card saying that this is your base level on an annual checkup where you constantly have that track record of of that individual. But today anyone should be able to get into a primary healthcare and start with a basal electronic medical record where you measure the vitals. In fact, we as a company under our CSR programs, we have started something called Ilaj Primary Health Clinics, where we actually have used technology to basically start with an electronic medical record that captures your vitals. You can decide which tests you want. You can do all this today because of technology. You can store a lot of data on cloud. So you're going to get tons of data coming out. So if you can actually support this on a e-backbone, then you start connecting the dots. Then you can almost do profiling of disease, profiling of various conditions. For instance, we are doing a very interesting technology-led approach to oral cancer. If you want a universal healthcare system that's affordable, okay, you need to downstage disease, which means you must catch disease early. So here we are using basically image technology, where you take an image of the oral cavity and you can actually start looking at lesions. And now today there's technology which, similarly we are doing various camps for women. New technologies are coming up which are not sort of intrusive technologies, where you can do breast cancer screening, you can do cervical cancer screening, so oral cancer, so all this is happening, but it's happening in a very disparate way. So if we can actually start building
the connection
and shaping and connecting all the dots, it can make a huge difference.
You clearly, just what you talked about is about this aspect of
data capture. Today, there's so much technology that you can actually use, like, creating noise to basically give you that privacy if you want. So that, an individual's data need not be shared without consent.
Correct.
Okay. But if you want to look at the epidemiology and if you want to see the aggregate data, that should be something which is important. Right. So you're looking at data from a policy making point of view, because it's very useful for policy makers when they look at certain data and to see how to do things. And from an individual's point of view, where they want to know their data because they need to be treated. So I really think that all of you have a huge opportunity to think about where you can play. Where can you make the difference? Where can you help your customers to even identify their own inefficiencies, because many of them don't even know where their inefficiencies exist.
So, I can't thank you enough. So please give Kiran a big hand.
Thank you so much.